Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Delta State government relaxes restrictions on religious centers as more COVID-19 survivors share their experience. Federal government continues to cushion the economic shocks from the effect of COVID-19 as thousands in Yobe State get food palliative. And Hong Kong relaxes restrictions as new cases continue to decline. Our hands are one of the primary ways by which infectious diseases like COVID-19 can spread. You're reminded to take responsibility by washing your hands frequently with soap under running water for 20 seconds. The Nigeria Center for Disease Control, NCDC, says it's still coordinating a multi-sectoral National Emergency Operations Center, EOC, that's activated at level 3. And it continues to coordinate the national response to activities on the coronavirus pandemic. In its latest announcement, the NCDC confirmed more cases of the virus, putting the total figures in Nigeria at 54,247 after 239 new confirmed cases and 10 deaths were recorded in the country last night. Till date, 42,010 cases have been discharged and the death toll now stands at 1,023. Plateau State led the new cases with 116 cases confirmed in the state, followed by the Federal Capital Territory, which recorded 33 new cases. Lagos was in third place, 19 cases, Ekiti 12, Kaduna 11 as well in Ogun State. 8 cases were recorded in Ebonyi, 7 in Benue, 5 in Abia State, 5 again in Delta State, while 4 cases were recorded in Ondo, 3 in Edo, 2 in Imo, 2 in Osun State, and 1 in Bauchi State. According to the World Health Organization, consistency during the COVID-19 response is vital for us. The health system is strengthened. Its performance and preparedness levels must be assessed as well regularly. Now, figures from its Africa region shows over 1.2 million confirmed COVID-19 cases on the continent, with more than 984,000 recoveries and 29,000 deaths cumulatively. The Ebonyi State government has commenced the distribution of hand sanitizers and sterilizers to students and health workers in the state. The state governor, Mr. David Mahi, disclosed this at the Ecumenical Center, Abakaliki, the state capital, where he revealed that the hand sanitizers and sterilizers will be distributed to teachers, students, health workers to prevent them from contracting the coronavirus. While the effect of the coronavirus pandemic is still being felt across the world, the federal government, under the Ministry of Humanitarian Affairs and Disaster Management, has handed over 69 trucks of food palliatives to the Yobe State government to mitigate the impact of the pandemic. Making the presentation on behalf of the ministry, the Northeast Zonal Coordinator, National Emergency Management Agency, Ms. Shaya Issa, says the palliatives are meant to assist over 40,000 vulnerable households across the state. She explains that Yobe State, being one of the major food producers, over 11,000 farmers have also been screened to benefit from the final phase of the Emergency Agricultural Intervention Program approved by President Muhammadu Buhari.
We are here to present to you assorted grains from the National Food Reserve, approved by the President and the Commandant-in-Chief of the Armed Forces of Nigeria, President Muhammadu Buhari, GCFR, as palliative for distribution to vulnerable persons affected by the recent restriction of movement to curtail the spread of COVID-19 pandemic.
These are the highest goods that we receive in the state that is going to be distributed to the affected area. So there's nothing we can say. We can thank to the federal government as well as our governor.
Over in Delta State, worship centers can now hold more than one service in a day, but with strict adherence to COVID-19 prevention protocols. The Delta State government, through the State Commissioner for Information, Mr. Charles Sanyago, made the announcement at a press briefing in Asaba, the state capital. Before now, churches and mosques were not allowed to hold more than one gathering in worship centers because of the pandemic. He says that now the restrictions have been eased. Religious leaders must ensure that their members adhere strictly to the safety guidelines. Mr. Anyago, however, appeals to those whose businesses have been impacted by the lockdown to be patient with government, as the restrictions will be reviewed as soon as it is safe to do so. Meanwhile, more have joined the fight against victimization and stigmatization of COVID-19. We have one survivor tell her story.
Before now, churches were only allowed to hold a single service. But now, we are going to allow worship centers to hold more than one service, but they must still adhere strictly to the social distancing rule, strictly to the wearing of face masks, and then of course, the washing of hands or sanitizer, use of hands and alcohol-based hand sanitizer before worshippers are allowed into the premises of such worship center.
When I got the news that I tested positive, I was shocked. I didn't know what to expect. I knew I wasn't going to die, but I didn't know what to expect and at some point I was like, is this even true? Is it real? Because when my result came out positive, I had no symptom. I had no symptom whatsoever. So I'm like, how is this possible? Not until I had a little bit of, it didn't last for like 2-3 days. It was just like a short while, a bit of sore throat. And then that was basically it. Yes, my case was mild, but still there are people that I know who had severe cases of, they experienced everything, that comes with the virus.
Dr. Mike Nwoko is the Senior Special Assistant to the Governor on Health Monitoring and a member of the Delta COVID-19 Task Force. He joins us via Skype from Asaba. Thank you for joining us on the program. Now, lately, Delta State has been driving survivors of COVID-19 to share their experience and also educate the public. How are you doing this? Because usually people are distrustful of government.
Yes, thank you so much for that question. You see, it is part of the strategy that has been adopted by His Excellency Senator Dr. Ifeanyi Tokowa, the governor of Delta State, and of course the entire COVID-19 team, to ensure that the entire operation is coordinated in such a transparent manner. You agree with me that when we started the COVID-19 operation, we had this challenge of many persons, including some educated persons, not believing that COVID-19 was real. And so it was a huge challenge. And so the government order realized that there was need to ensure that the operation is coordinated in a transparent manner by bringing some of the survivors of COVID-19 who never believed that COVID-19 was real to attest, to the fact that COVID-19 is real, while also highlighting their experience during the course of their treatment in the treatment facilities. So it has really helped us in drumming this advocacy and sensitization on the need for the people to adjust their belief system in order to accommodate the reality of COVID-19. This has really helped. And if you look at the statistics today in Delta State, as at the 21st of July, we had about 759 cases on admission. Today we have about 161 cases on admission. If you just oppose it with the figure at that time, you will come to the irresistible conclusion that we are really flattening the curve in Delta State. However, the entire COVID-19 team, is not sleeping. We're not resting at hours. We're still working around the clock. Even though we have been able to flatten the curve, the whole idea is for us to be able to sustain the tempo, because attaining success in life is not really a problem. But where the issue lies is ability to maintain the success rates recorded. The whole idea is for us to sustain the tempo so as to avoid a second wave of the pandemic. And what are we doing? We are continuing in this our advocacy and sensitization on the need for people to adjust their belief system in order to accommodate the reality of COVID-19 by ensuring that the people continually comply with the preventive protocols, such as the social distancing factor, the regular washing of hands with clean water and soap, or use of alcohol-based hand sanitizer. Then of course the compulsory use of face masks in public, because if we avoid clusters and we get people to actually adhere to these preventive protocols to a large extent, we will be able to sustain the tempo with respect to flattening the curve. They haven't realized the fact that the entire operation is on a tripod, which has to do with first ensuring that people adhere to the preventive protocols, then enhancing our testing capacity in the state, then of course contact surveillance, and then management, which includes the incident and the case management. You will agree with me that here in Delta State, we are addressing it holistically under the able command of the Center of Defiance of COA, so that at least the large extent the safety of all residents of Delta State will be effectively guaranteed. As far as this COVID-19 struggle is concerned. So we're working around the clock, and we have the firm belief that we'll sustain the tempo and will avoid the second wave of the COVID-19 pandemic, and people will be free of COVID-19 in Delta.
Dr. Walker, give us a little more information as to the tracking and tracing measures. How does government perform that?
Yes, in fact, I will have to state here, without fear of contradiction, that Delta State have consistently maintained a 99% success rate in contact surveillance. And you'll agree with that contact surveillance is germane in the fight against COVID-19. Because if you are not able to identify the POIs, the persons of interest, it's really pretty difficult, because these carriers, of COVID-19 in society who do not know that they have COVID-19 are more dangerous in the society than those who have been confirmed, positive, because once they are tested and confirmed, they are taken to the treatment, facility. So the state is taking the contact tracing exercise very seriously, and they have deployed a large number of disease surveillance officers who have received proper training to go from the areas where cases, have been reported. When we had our first, in-depth case in April, the surveillance officers were deployed accordingly, and they were going from door to door. Even when we had the spikes in the, COVID-19 figures in the state, they were also working on the clock to identify the POI. So these are helped us to really flatten the curve. We're doing whatever we're doing with precision. His Excellency the Governor, who is the medical doctor, and the only medical doctor who is the governor today in the country, understands the dynamic of public health, crisis of this nature, and is working around the clock through the entire COVID-19 in the state to ensure that we sustain the tempo and, of course, effectively guarantee the safety of all residents of Delta State following the outbreak of COVID-19.
We'd like to thank you. Thank you for that update. Dr. Michael Walker is the Senior Special Assistant to the Governor on Health Monitoring and a member of the Delta COVID-19 Task Force. Thank you for joining us on the program.
Thank you so much for having me once again. I appreciate it.
Now, the fight to curb the spread of COVID-19 amongst transporters in Bayelsa State is not limited to those plying the roads. Those in charge of water transportation say they are also complying with the NCDC guidelines to curb the spread of COVID-19. Is our correspondent Dobrat Timiwood with more.
Bayelsa State is 80% riverine, hence the major mode of transportation in the state to the hinterlands to most of the communities is via speedboats and canoes. We spoke with the chairman of the Boat Transport Association in the state on measures they've put in place to protect their passengers against the coronavirus, and here's what he said.
We have all the necessary equipment. We have the sanitizers. We have the face masks. Then we have all the necessary facility of the COVID-19. But because of the issue of the COVID-19, of the distant spacing, we carry 6 on the W19, while we carry 12 on the W23. 3, which normally carry 24. We still maintain the same old transport fare. We don't increase transport fare. It is the same transport fare we are using, just to help the masses.
The number of confirmed cases for the coronavirus in Bayelsa State is almost at 400. As of today, there are 391 confirmed cases in the state and only 22 active cases. 3 persons were discharged and the state has experienced only 21 deaths. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Is insecurity undermining the COVID-19 response? We have that story and more when we return. Please stay with us. Cross River State was one of the last states in Nigeria to confirm a case of the coronavirus. Till date, the state has recorded 82 confirmed cases, 73 persons have been discharged and 1 person is currently receiving treatment. Just this week, some of the frontline workers under the Nigerian Medical Association NMA in the state embarked on an indefinite strike over the kidnap of their colleague, Dr. Vivian Otu, a pediatrician and a staff of the University of Calabar Teaching Hospital. The state chairman of the NMA, Dr. Innocent Abang, disclosed this during a peaceful protest by doctors across the state to express their own happiness over the incident, what they've described as one too many.
We have come here to present our pains, our grievances, because our colleague had just been kidnapped on the 28th of August, 2020. And this made the 16th person to be kidnapped. And we think it's become one too many. And so we came to tell the National Assembly, the State Assembly, because they had told us before now, when the last doctor was taken, that there is a legislation. There's a bill that has been passed that they needed the government to assent it, even prior to this very present State Assembly. So we want to ask them, what is hindering the state governor from assenting this bill? Because there's no state legislation against kidnapping. And that's making Cross River a safe haven for all kidnappers.
Here, as a government, I will accept we failed to protect. But it is not the responsibility of only one person. Security is the responsibility of all of us. Kidnapping, for us as legislators, since 2015, we passed a law and was signed and gazetted. The will to carry out that law has been the problem.
Now, some evidence from Nigeria victims of violence are less trusting of measures taken by Nigeria's government. This is according to a USIP Commission survey conducted in May and July 2020 of more than 10,000 Nigerians. It found new relationships between violent conflict and the coronavirus response. The data shows that victims of violence are more likely to distrust the Nigerian government's response to COVID-19. Joining us is Dr. Kayode Adebayo. He's the immediate past chairman, NMA Lagos, presently member of the National Executive Council, Nigerian Medical Association, and consultant to the Lagos State Health Service Commission. Thank you for joining us on the program.
Thank you.
All right, what's your take? Insecurity, do you think it's undermining the COVID-19 response from that clear example in Cross River State, where they're saying it's one too many, that medical doctors are being kidnapped?
Oh, yes. One of the major problems we are going to face in combating COVID-19 is actually insecurity, especially of the medical personnel. I think the government has failed us in this area totally. Let us be very sincere. Kidnapping of medical doctors or other health workers have been so frequent, especially medical doctors. And what exactly has government done so far about it? It's just people, we've been out so many times to protest here and there. Unfortunately, government has not done anything. So if government chooses not to, and the doctors generally decided to nationwide go on strike, then what happened to victims of COVID-19, both on admissions and on self-isolations and treatment? So if government choose not to do anything serious about this kidnapping of medical doctors, then we are ending to crisis. Okay, a state is on strike now. What can we say is exactly going about the healthcare system in that state? People that are critically ill, people on oxygen, people that just had surgery before the strike, what happens to them? So if government will do anything at all, I think they should just they should just do something about the security of their personnel. Many a times, I myself, 1 a.m., 2 a.m. in the night, ambulance come to pick me in the house for emergency surgery. At times, I just fear that, well, I just hope I get there safe. When coming back again, oh, I just wish I get home safe. We practice in fear.
Apart from insecurity, they're saying that COVID-19 as a pandemic has perhaps brought to light more pandemics, and one being insecurity, several others as well, with regards to the poverty and, many other economic challenges. But I want us to look at Lagos State, and this is seeing as you are a consultant to the health service, and look at its trajectory of the disease. We've heard that Lagos peaked in August. Now, from the cases we're getting, are you saying that, do you agree that we're flattening the curve in Lagos State?
Well, no, we can't say we are flattening the curve in Lagos. You see, if we say the values are dropping, the question is, are we testing enough? It's only if we can assure ourselves that, yes, we are testing enough, then we can say the values are dropping. If you look at it critically, we are looking at values and we are looking at figures and not human values. Between August 1st and September 1st, Nigeria we have lost about 170 to COVID-19. Just imagine if in a country a plane crashed and we have about 170 passengers and they all died. Would they have gotten over the money or the shock? You see, if you look at it critically now, we major challenge you are facing. I'm a medical doctor, I see patients every day. And we see patients, both the poor and the rich. If you sample people's opinion now, people don't even believe the coronavirus infection is real any longer. A lot of times in the consulting room, a bricklayer told me that, have I seen a bricklayer that has coronavirus? Or have I seen an agbero that has coronavirus? You see, fine, our political leaders once in a while disclose that, oh, they had this, they've gotten over it. But we are not hearing from these survivors. Let's take stories from survivors. Showing figures is not just enough. You see, look at Brazil. Brazil will showcase people on oxygen, on ventilator. They go down to people where they were doing mass burial so that people will see this in reality that, look, this thing is real. Let us say government, to be honest with you, are doing very well in terms of this coronavirus. We could always ask that they should do more. But so far, so good, they are doing very well. But the major problem there is that we are not showing what we are doing. Okay. We are not even showing people in the isolation centers. We are not hearing from survivors. People just see values and they keep thinking that those values are just being manipulated. Let us show human beings and not just values and figures.
I'd like to thank you, Dr. Kayode Adebayo, immediate past chairman, NMA Lagos. Thank you for joining us on the program.
Thank you very much. Not immediate past chairman. I was partial after some time. Thank you very much.
All right, thank you. Now, Hong Kong is relaxing some COVID-19 restrictions as the city's locally transmitted cases starts to drop. Starting Friday, restaurants will be allowed to extend dine-in services until 10 p.m. instead of the current 9 p.m. rule, while gyms, massage parlors, some sports grounds and playgrounds will also be allowed to reopen.
Pope Francis held his first weekly general audience with a live crowd in 6 months as the Holy See slowly lifts restrictions imposed due to the coronavirus pandemic. About 500 people attended the audience, held in the San Damaso courtyard in the Vatican's Apostolic Palace, nearly all of them wearing masks and keeping social distancing, except for when the Pope walked near them. Pope Francis, who last held a public audience with a live crowd on March 4th, clearly enjoyed himself as he walked past the crowd, stopping to talk to people from a distance of 1 or 2 meters. Colombia is altering compulsory preventive isolation against the COVID-19 pandemic nationwide to selective isolation, allowing for the reopening of its economy. The government will lift most of the measures that limit people's movements, but still restricts confirmed cases, suspected cases, and their close contacts from going outside.
Take a look at our website, channelstv.com. It has the latest updates on the pandemic. You can see COVID-19 there plunging Brazil into recession and several other stories across the world. That's the program this afternoon. Thank you for watching. I'm Millicent Nwonwoka. Stay healthy, stay safe.